Okay, we're going to go ahead and get started. Again, thank y'all for being so patient. We're just happy that she's here. I know it's a couple minutes past, but this is going to be well worth our time. So we are going to go ahead and get started. A couple housekeeping items because we are on Zoom. Jane doesn't have access to it. So if you do have questions, please put them in the chat box. It's a function down at the bottom of your screen. A chat box will pop up on the right. Enter anything that you want to ask or say in there and I will address them. This session is also being recorded. So if you feel like you want to take a bunch of notes, don't feel pressured to do that. You can always go back and rewatch when it is posted to the Health Science Center's YouTube page. So I'm sure I've seen some of you, I've met a lot of you, but my name's Katie Heesh. I'm the Community Relations Manager here at the Health Science Center in Fort Worth. Today we have the pleasure of speaking with Jane Oderberg. She is an instructor here at the Health Science Center. Jane has worked in geriatric social work for 26 years in a variety of settings, including senior citizen centers, mental health agencies, private psychiatric hospitals, long-term care, assisted living, and dementia-specific facilities, And she has also facilitated many support groups for adults with aging relatives, as well as dementia support groups, and speaks locally on a wide variety of topics related to aging. And that's why she's joining us today, our topic being caring for caregivers. So Jane, thanks so much for dialing in. We're happy you're here.
Thank you. Thank you.
So before we dive into today's real content, I want to know a little bit about you and how you ended up here being a part of the HSC family.
Well, I had retired actually from social work in 2016, and Dr. Knable, I'm blaming this all on her, Dr. Knable invited me to lunch. She said, "Oh, we missed your retirement party, blah, blah, blah." She takes me to lunch, had a lovely lunch, caught up, and then she slips a piece of paper over and says, "The highlighted portion is what you need to read." And I said, "What is this?" She said, "It's a job." I said, "Well, I don't know that I want to work full time." She says, "That's so lucky for me because it's a part-time job."
That's great.
So that's how it happened. And I was the project manager for some research that two of the docs were doing. And that was my first job. And then we were given some money from the Heath Foundation grant to develop some programming around caregivers, and that's what I'm still doing. So that's how I got there.
So have you been with us for the last 4 years then here at the Health Science Center?
Since 2017.
2017. Okay, perfect. Yeah. Well, most of your career, like I mentioned, has centered around the work related to geriatrics. So what inspired you to be involved in this work?
I fell into my first job, literally, back when I was in school. There wasn't a gerontology kind of track or anything. And the Jewish Community Center here was looking for a center director. And I thought, oh, I can do that. I like old people. I have old people in my family, so maybe it'll be okay. And I was edged out of that position by somebody who had a dual degree. One of them was gerontology. So she and I were both pregnant at the same time. Her baby was due before mine. So they asked me to fill in while she was on maternity leave. And I loved it. Several months later, she and her husband were returning to California, where he had accepted a position, and I was hired to run the senior program there. And from then on, it was sort of learn by doing, and I found that I really, really, really liked it a lot. So
that's wonderful. The rest is history then.
Absolutely, absolutely.
So in your time here at the Health Science Center, you've taken on the role of teaching a 6-week online course titled Dementia Cares, and CARES is all in capital letters. So what does that exactly mean? Can you explain it for us?
Sure. It stands for Caregivers Accessing Resources, Education, and Support. And we did hold it in person for quite a few sessions. And then, thank you COVID-19, we have now had to transition it and abbreviate it a little bit. So it lasts approximately an hour, hour and 15 minutes, as opposed to the 2 hours that we did before.
Mhm.
And we meet weekly for 6 weeks.
So what are some of the things that you cover in this class? And as a second part to that question, with it transferring to online, have you seen the education be a little bit different, or have you seen a spike in participation since people can do it from home?
Yes and no. People doing it from home, if they are the caregiver and their care receiver is also in the home, it sometimes makes it difficult for the participant. Not everybody does have their person living with them, but it's the way that it works. So I also tell them about Dementia Friendly Fort Worth does some live on the computer at the very same time that I have the class. If the care receiver is well enough to be able to access it, they have musical programs, they have bingo, they have baking, they have all kinds of stuff. And if the person is able, once the computer's set up for them, then they have something that they can do. So that sometimes causes some issues, but we cover different behaviors. How do caregivers ask for help, since we're the very reluctant ones to do that? Communicating skills, community resources. We give everybody dementia through a program called Dementia Live, which is a simulation program that has transitioned by the person who developed it to an online platform. And so we kind of give the caregivers a taste of what it's like for their loved one to have dementia. And then, of course, we talk about caring for the caregiver. And if anybody has, a particular topic they want to throw in there, we add that as well. Yeah.
And I know we're going to discuss this at the end, but somebody did ask in the chat if it's open enrollment.
Yes, it is. The next cohort starts on Wednesday, January the 13th and runs through February the 17th. It's at 10:30 in the morning, and they have to email me at jane.oderberg@unthsc.edu, and I'll sign them up, and then they'll get the Zoom link right before we start.
Perfect. And I know you told me this, but just to tell everybody else, it is a free resource, correct?
Yes, absolutely. There is no charge for it because fortunately we are funded by a private foundation.
Perfect. That's such a great resource to have, especially for people who, this kind of springs up on some people as the caregiver. So having that free resource and having somebody to teach you these things that you need to know immediately it's invaluable. It's amazing.
Yes.
So in a conversation that you and I had, you said the most important aspect of being a caregiver is, quote, getting educated before you need it. So can you expand on what you meant by that?
Yeah, we sign up for all kinds of classes, making charcuterie boards and decorating and cooking and all that. But somehow we don't ever think that our loved one, be it a parent or a spouse or a sibling or a friend, is ever going to need our help with some kind of a major illness. And particularly with dementia, it hides for so long. And I always say, get informed before you need to know. We work in healthcare, but that doesn't mean that we know everything. Although lots of people in the hospital think we do, we have to remind them that we are the family member. We are not whatever our professional designation might be. So learning about dementia or diabetes or congestive heart failure, whatever it may be, but particularly with dementia, because then you'll know what to look for. You'll know when things just really aren't right and what steps you should take to make them better.
That's great information. And I know also yesterday you had said that dementia will touch people's lives one way or another, and you had a quick saying about the 4 different things. Do you remember what that was?
Oh, sure I do. It's a quote from Rosalind Carter, who has the Rosalind Carter Caregiver Center. And she said, and I quote, "There are only 4 kinds of people: those who have been caregivers, those who currently are caregivers, those who will become caregivers, and those who will need a caregiver." And that's true. A quick story, which I had told you yesterday. I had a friend whose mother lived far away and near to her sister, but still far away. And I was trying to get her to take another 6 weeks course I did about caregiving. And I said, well, what would you do if your sister called and said, Mom fell, fractured her hip, and I don't know what to do. And they're making all these, they're asking me all these questions. And I said, what would you do? And she didn't miss a beat. And she told me that she would call me on the phone and she knew I'd help her, which was not what I was looking for her to say. But nevertheless, yes, I would have. So learn. Yes.
But yes, we all need to know for our own knowledge and own being able to do it by ourselves. So thank you for saying that.
Mm-hmm.
So we talked about, that dementia can creep up on you, but are there warning signs or are there things that could be of concern when you start to see it in a loved one or a parent or somebody around you?
Well, there are, and this is on the Alzheimer's Association website. There are certain signs and symptoms, one of which is the memory loss will disrupt your daily life. You forget dates, I show up to take you to lunch and why am I there?
Right.
Repeated questions, the same thing that you've answered over and over again. And normal aging is where you might forget somebody's name, but you do remember it later. There are challenges in planning things or problem solving, like following a recipe that you have always done your whole life, paying bills. Usually this is when number sense goes. You're not balancing the checkbook. You're not paying bills. And for normal aging, you might make an occasional error in handling your finances, but you see what happened and you can fix it. Completing familiar tasks like driving to places that you've always gone and you end up in Wichita Falls.
Right.
Organizing a grocery list, going shopping, multi-steps. Laundry has multiple steps, although we don't think about that. And normal aging, sometimes you need help with your computer, and I always ask my grandchildren, or a microwave, or how do you TiVo a show, or something like that.
Right.
So, some of these, and confusion about time and place, with visual images and spatial relationships, depth perception is off. So that's why you see people walking very carefully when they're doing steps or getting into a bathtub, because it looks like a bottomless pit. So, and word finding problems that are really severe. So there are a lot of things, but like my grandmother who had vascular dementia did, she always had an answer that was very plausible. I mean, for the situation, she always had, well, why didn't this happen? Well, she had an answer. And until my mom really recognized what was going on, she had us fooled for quite a long time.
So when these warning signs start to come up, is it more often an everyday occurrence, or is it once in a blue moon until it's more severe?
It It's pretty apparent. It's, pretty apparent. I always say if you have a question about your own brain working properly or a loved one's brain working properly, that you should go to a physician who knows what they're doing. If you're of a certain age, going to a geriatrician, just like your kids went to the pediatrician and your dogs or cats go to the veterinarian, you need to see a physician who is well versed, and testing can be done to find out what exactly is going on, because it could be something that's treatable and reversible and not a terminal diagnosis.
That's great information. Thank you for sharing that.
Mm-hmm.
So let's speak more to the caregiver side of that, because today's topic was caring for caregivers. And in one of our initial emails to each other, you had put a line that said caregiving, working, and family. Oh my. Can you expand on what you mean by all that?
Sure. Most people who are caregivers are women. It just works that way sometimes. 1 in 5 adults are providing unpaid health or supportive care to a family member, a spouse, a partner, a parent, a friend with some illness that they have. And most of them who are providing at least 24 hours a week of care to their relative, 61% of them also have a job. So where we used to talk about the sandwich generation, where people are, you're the peanut butter in the middle of the sandwich. You've got your older relative on one side and then your family members on the other. And I would think that particularly now with having to be working at home, if you have school age kids and they have to have school, I just think it just gets crazy. And it can be very, very exhausting on the caregiver, especially if you're the only one who's doing the care. So for some reason, we feel that we must be that one person, and we're very reluctant to ask for help in any shape or form. Right. So until it gets really, really critical, like all of a sudden you have a heart attack because your blood pressure's gone through the roof, does anything ever happen about that?
Right. I think that's human nature too, for all of us to say, no, I'll take care of it, I've got it, until we just explode. So it is important to remind yourself as a caregiver to have grace with yourself and take care of yourself, because you can't fill other people's cups from an empty cup. You got to fill your cup first. So
that is right.
Extremely important. Do you have any tips or tricks that can be useful to somebody who is currently or maybe one day will be a caregiver?
Take care of yourself. That's just the most important thing. Know the community resources that are wherever your loved one lives, Tarrant County is amazing with resources. It's fabulous. But there are resources if you're having to do long distance caregiving, if you need to find out what resources are available where your loved one may be, but find out what's out there and take advantage of it. So, just take advantage of everything that's available. Some things are based on income, but most of them are not. And you can find resources that are out there for you.
Speaking of resources, do you have any good online or local resources for people
Sure.
that you use right now?
Sure. The Alzheimer's Association website has all kinds of things. That's alz.org. And you can put in what part of the universe you live in, and they can take you to the page for the support activities. They have educational programs. They have videos. I mean, just all kinds of things that are there. And the James L. West Center for Alzheimer's Care also has a lot of the, they've all gone to virtual support groups like the rest of us. And so it's jameslwest.org, and they have educational opportunities as well. And they'll answer questions. Those two are the ones to go to first. But then there's a thing called 211, which is centralized information and referral all over the United States through the area agencies on aging. So you can call there and they'll ask you what city or what county or whatever, and you can get resources that are available elsewhere. Of course, the area agencies on aging, they're all over. Every state has them, and they can also provide information. There is an elder care locator, which helps find resources outside of your given area. There is a website called caregiver.com that has, I mean, you can just Google caregiver and you can find a lot of stuff.
I'm sure there's many, many resources, but thank you for providing those ones. I trust them if they're coming from you.
Well, thank you.
And it's nice to know because, you know, we all live such busy lives, and myself particularly, I have grandparents in Arizona or Washington State. So it's nice to know that I could look up resources for anywhere, which is great. So we are going to start wrapping up. I have actually about 5 or 6 questions that we're going to get to. They were submitted previously. So before we get to that though, do you have any closing words or stories that you'd like to share with us?
I have all kinds of stories, but somebody said I should write a book someday, and maybe I ought to.
You should. I could read it. That would be great.
One in particular, my mother was a very, very bright woman. She was brilliant. She went to college at 15 and was practicing law at 21. So she was an only child, and my grandmother developed vascular dementia. And this was back when they didn't know nearly as much as they do now. So that meant that she had a series of memory impairing strokes. And every time she'd have one, her abilities would decrease in a stair-stepping kind of way. And my mom could not understand why her mother didn't know who she was. Mm-hmm. She had no idea who she was. And she would just look at my mother blankly. But when I was there visiting one time, my mom and I shared the same voice. And my mom, you know, she was saying to my grandmother, "But mother, it's me, Louise," and there was nothing. I walk in the room and all I say is hello. And my grandmother's eyes popped open. She tapped my mother on the shoulder and pointed at me and said, "There she is. There's my Louise." And she called my oldest daughter by my name because I was an only child. So she didn't know who these other, I had 3 children, so she didn't know who they were, but she thought they were cute. But to get my mom to understand that her memory of my mother at that point in time was of a young mother with a young daughter. She had no idea who this 70-year-old woman was that was trying to convince her she was her mother. So,
right.
Yeah.
In a situation like that, do you have any advice as the child of somebody maybe you're caring for when they start to forget those things? I think it's human nature for us to take that personally, and it hurts. But do you have any words of wisdom or, you know, some words to help people that maybe we take it a little too personally?
Yeah, well, you always have to remember it's the disease. It's not the person. Right. If their behavior changes and they become combative all of a sudden, it's not that because they go, "Oh, look, there's Katie, I'm going to slug her one," you know, or throw something at her. They're not going to, that's not how it works. It's the disease that causes it. And because the little memory eraser has erase the part about that you are an adult now and not little Katie, that you are, is gone. They just don't know who it is. And many times they'll call you by their siblings' names if they have had siblings as well. But you just can't take it personally.
That's a great word of advice. And I think, like we said yesterday in our conversation, I think the hardest part is that it feels like a loss before an actual loss. And so you have to find those like shining moments within it. So I told you a story, and I'll say this briefly. I had a grandmother in my life. She had severe dementia, and she wouldn't know up from down, but we would cheers our drinks at every meal. And we would always say, Jean, what do you want to cheers to? And she would say, to better days. That was the only thing she remembered. And so just that shining moment in the day for me, it was enough, even though she forgot everything else. So you just have to find those moments of happiness, I think.
Yes.
So I want to get to the questions that were submitted to us. I see some things in the chat box too, so we'll get to those. One question that was submitted says, what is the difference between dementia and Alzheimer's?
Dementia is an umbrella. It is signs and symptoms of something wrong with your brain. And then Alzheimer's is a form of dementia. There are many. They all carry the names of the person who saw them first. There's Alzheimer's, there's Jakob Creutzfeldt's disease, there's Binswanger's disease, Lewy body. I mean, it goes on and on.
Right.
But dementia is the group of symptoms.
Okay. Thank you for clearing that up. Another question that we had, somebody asked, is dementia reversible?
Sometimes. If you have a delirium and usually happens in the hospital setting, that because if an older adult's put under anesthesia, it can take a long time for it to clear their system. And once it does, things go back to normal. But there are treatable and reversible things like vitamin B12 deficiency or hydrocephalus. And when they do the workup for everything, they're looking for things that they can rule out and say, well, it's not that, and they don't have a brain tumor, or they don't have B12 deficiency. And then it must be some form of dementia. And then after neuropsych testing, they can usually pinpoint it down to what type.
Okay, that makes sense. So I have a question to piggyback off of that then. And you may not know this, and that's fine, but somebody asked, people with symptoms of dementia often are put on medication. What is the medication for? Is it for memory?
It's to slow the decline of the memory.
Okay.
The type of drugs that we have now is just to not make it a, downhill slide very rapidly.
Okay. That makes sense. So then the next three that I have are specific. There are no names or anything, but somebody wrote, my mother was recently diagnosed with mild dementia. Is it good to give her in great detail explanations of what is true from what must be her imaginations or dreams? I do leave notes around the house and they help.
Leaving notes is good as long as they still can understand what the words are. Because they can still read words, but they don't comprehend sometimes. So we tell people, label the cabinets, and so that if they're looking for something, they would know where it is. I don't ever correct a misperception.
Okay.
If somebody says that it's 1928, you should go to where that person is and say, well, what happened then? And let them tell you.
Okay.
What happened, but go where they are. They're not ever going to come back to the here and now.
Right. And do you feel that if we do try to do that, it confuses them more and it makes them feel maybe a little self-conscious or more confused than they were?
Yes. Yeah.
Okay. So I have another question from somebody, no names. I notice when my mother is tired, she's at her worst. Is this a common thing in each person, or can it be different? We pretty much stick to a schedule, and I let her sleep no matter how long in the morning. I never wake her unless that we have a doctor's appointment. So do you notice when people are tired that their dementia symptoms are worse?
Yes, and they usually have sundowners, which is, when the sun goes down, it gets darker, shadows and whatnot. And that's when behaviors can really, really get bad. But if you're tired, if I'm tired, I'm a tad cranky myself. So I can see, and being on their own schedule is excellent. Always have a schedule, always. And, the rule about don't wake them up if they're sleeping, I agree.
Perfect. Thank you for clearing that up. And then the last one that I have that was submitted previous to this, it says, mother is happy most times. She is on an anxiety medication, as well as a dementia medication. But there are times when sadness takes over. Her whole mood changes and she doesn't want to listen to anything I have to say. What should I do?
Leave her alone.
Simple as that.
And, you can ask what's bothering you. I noticed that you seem a little upset to me. Can you tell me what's going on, and see if she does? But if she wants you to answer something, she'll probably ask you.
Okay. So I'm going to open the chat box here. Let's see. So, it looks like we already answered them. Somebody was asking about the CARES program you have here, and it is free. It's open enrollment. And can you give us the dates of that again?
Yes, it is Wednesdays, January the 13th through February the 17th from 10:30 to 11:30 in the morning.
And if they want to enroll in that, they email you, correctly? Or
correct?
Okay.
Mm-hmm.
Can you say your email for us one time?
Sure. It's Jane.Oderberg, Oderberg, at UNTHSC.edu.
Perfect. The other thing that was in the chat, somebody quoted you saying, it's the disease, not the person. And I think that's a great sentiment to leave on. As the caregiver, you have to give yourself grace and take Jane's class.
Absolutely. I'd love to have you all.
Well, thank you so much for your time today. I appreciate you working through all the technology problems to have this discussion, because I think it's so important. We learned a lot. Like I mentioned, this is recorded, so all of those great resources and everything that Jane had mentioned, it'll be here. It exists forever. We will post it to YouTube, and we can send a follow-up email with the link included, so you don't even have to search for it. So any closing comments you'd like to make?
No, I'm here. If you ever have a question, you can send me an email, and because I'm still working at my house, so and I'll be happy to answer you or direct you or say sign up for the class. So
perfect. Well, thanks so much for your time today.
You're welcome.
And thank you everybody for participating in another Speakers Bureau series. We are not doing another one until the new year, so we will see you all in 2021. Have a safe and happy holidays. Goodbye, everybody.